With more information, we're joined this morning by Dallas County Health and Human Services Director Zach Thompson. Thank you so much for being here.
Thank you.
Are hospitals in North Texas really ready to see cases of Ebola? I mean, are they prepared, and are other ones being prepped as well, just in case?
We got the best hospital system, nurses, doctors in the world. The fact that we have a preliminary discussion about an Ebola case demonstrates what's going on in Africa and what impact it can have on the United States. But our hospitals, our medical community is the best in the nation. The concern, though, is what's going on in Africa, the number of new Ebola cases we're seeing, and how to deal with this epidemic there, that it does not spread to the United States. The fact that a person presented themselves to the hospital with symptoms, and now the CDC and the state and Dallas County Health and Human Services involved in looking into this. Later on today, we should have more information or confirmation on whether or not this person has Ebola.
Well, and then the story will really change depending on whether they do. But do you know how long this person has been back from Africa, and really what brought to this person coming to the hospital and saying, hey, there's an issue here?
Well, the hospital will probably get into more specifics later today. We know that the person had traveled to Africa, an endemic country where the Ebola virus is definitely an outbreak. And so by presenting themselves, the difficulty is you're talking 2 to 21 days in terms of an incubation situation where you could see these symptoms. And
so he or she could have been here for 21 days before, correct?
Well, the travel portion, we don't have the exact date when they arrive back, but the key point is that unless you have exchanged bodily fluids with this individual, this is a low risk for most people in Dallas County. So we want to ease the fear, is that you're talking about bodily fluids transmission, not just the fact of us sitting right here together as being an issue, but the fact that you've seen blood, diarrhea, those type of transmissions happen. So we want to put Dallas County residents, it's not that you saw this person at the grocery store that you should be concerned.
Yeah, I think that people hear that this person's being kept in strict isolation, and that raises people's fears. I mean, you've got to be understanding that.
Well, that's true, and that's the process. That's the CDC recommendation. But the fact that you have a great hospital and you got a great infectious disease staff that is working on this and in concert with the CDC demonstrates that we've not seen a case originate out of the United States. This is a foreign-born or an imported potential case. So you got the best system going in Texas, in Dallas, and you got the best minds working on it. Later on today, we'll have more detail. This is low risk at this point, so continue going about your daily work, your children going to school. Don't be concerned. We'll have more details later today.
Oh, wait. We'll look forward to that. Thank you so much.
Thank you.
Appreciate you joining us this morning.